Hello everyone. Thank you for coming to this talk. My name is Yu Chi. I'm from University of Pittsburgh. My co-authors are Dr. Daqing, Fanghui, Xiao, and Ning from University of Pittsburgh. I'm very happy to meet you virtually and present this work titled Connections and Disconnections Between Online Health Information Seeking and Offline Consequences. This study is actually part of a larger research project whose broader goal is to understand what, how, and how well health consumers can search and learn in online health information seeking. This project adopted mixed methods, including a controlled user study and an interview to collect data with regards to health consumers' perspectives and behaviors in the context of online health information seeking. To give you a background of this study, I will briefly introduce what methods we have adopted to collect data and the work we have completed so far. In the user study, we recruited 24 college students and asked them to search for two pre-designed tasks. Search logs were recorded and the questionnaire data was collected. We have analyzed a part of the user study data and published an earlier work which examined the participants' self-selection behaviors in completing different pre-designed online health information seeking tasks. As a contrast, this study focuses on the interview that was conducted after each search session. In the interview, 24 interview participants were recruited from University of Pittsburgh and Carnegie Mellon University. Before signing up the participants, we first exclude applicants from health or medical-related major because we expect to recruit lay people who don't have much health-related knowledge. Second, to make sure each participant could share at least one real health information seeking experience with us, we then filtered out the applicants who didn't conduct any health-related search within the last 6 months. As a result, 24 college students were recruited. In the interview, a semi-structured protocol was used to guide the conversation, and each interview lasted approximated 30 minutes. This interview data is used for this current study, and it helps us to understand the connections and disconnections between online health information seeking and offline consequences. Next, I will use a scenario to explain what I mean by online health information seeking and offline consequences, and the specific objectives of this study. Let's assume there is a health consumer. She has a health information need and decides to go online to search for it. In the online health information seeking process, she assesses online sources by her own criteria and selects sources accordingly. At a certain point, her online health information seeking is stopped, and it leads to offline consequence. For example, she decides to see a doctor. This oversimplified scenario illustrates the process we focuses in this study, and it also highlights 3 objectives of this work, which are health consumers' perspectives, consumers' self-selection criteria and actual selections, and the transitions between online and offline. So the first objective of this work is to elicit inputs directly from health consumers. Following the consumer-centered paradigm, we expected to use qualitative methods to invite general health consumers to talk about their own perspectives towards online health information seeking. Secondly, we aim to gain a deeper understanding of consumers' thought process and the corresponding behaviors regarding self-selection. This is because previous work found that consumers' self-reported self-selection criteria are not always consistent with their true selection. For example, a consumer claimed that they only select health information from authorized sources, but in the same study, they were found to select commercial sources, and they even rarely check the source of the information. We believe that examining the similarity and the discrepancy between consumers' thought and behavior provides implications to online health information source. Thirdly, we intend to characterize consumers' own health information seeking story and focus on a less examined topic, the transitions between online health information seeking and the subsequent offline actions. Here comes the research questions. Our first research question is that whether consumers' self-reported source selection criteria is a true reflection of their practical selection behaviors. Secondly, what are consumers' online health information seeking behaviors and what are the corresponding offline consequences? And why do certain online and offline transitions happen? The interviews were guided by a semi-structured interview protocol. The protocol mainly consists of two sections. In the first section, the participants were asked to express their perspectives on online health information seeking, centering around the question, how do you decide whether or not to select an online health information source and why? Secondly, we asked the participants to share a most recent or most impressive real health information seeking incident. To unfold the consumer's own health information seeking incident, we adopted the critical incident technique and designed a list of questions. Using the critical incident technique, we got the details about consumers' true source selection behaviors and the whole health information seeking process, including the follow-up offline decisions and emotions. And the conversation was loosely led by this list of questions. Next, I will introduce the data analysis and highlight some of our key findings. We first look at consumers' source selection criteria. What are consumers' self-reported source selection criteria? In total, 56 comments were collected for this question, and they were summarized into 10 criteria, which further fall into 4 overarching categories: provider-related, design-related, content-related, and preference-related. The number of co-occurrences is also reported to suggest the popularity and the priority of them in participant selection. The message we want to highlight here is that consumers' preferences for the provider-related criteria, especially the top-level domain URL, for example, .edu or .gov, were usually less discussed in previous work, while this study highlights the importance of them. We then extracted the mentions of source selection criteria in participants' real search incidents and compared it with self-reported source selection criteria in general perspectives. This comparison helps to answer the research question, whether consumers' self-reported source selection criteria is a true reflection of their practical selection behaviors. One new criteria pops up in the real search incidents, which is include personal experience. For example, participant 20 said that, I think YouTube videos are also really helpful because I feel like just because there is an actual person talking, I feel like I can trust him more. However, this criteria was not mentioned in the consumer's general perspectives towards online health information seeking sources. So we learned that some source selection criteria, especially the provider-related criteria, had high mentions in general perspectives, but was only recalled a few times in the real search incidents. We admit that the current data might not sufficient enough to conclude a significant inconsistency, but it deserves further study to look into the source selection criteria and their real usage. Given this discrepancy, we identify the design opportunities that will potentially help the consumers in recognizing the provider-related characteristics in SaaS selection. For example, highlight provider-related SaaS characteristics to consumers, like mark top-level URL domains in the search results snippet representations, or highlight provider information in the web page. These design features may help the consumers to recognize the provider-related SaaS characteristics in their assessment. Next, I will present the results of analyzing participants' own search incidents. What are consumers' online health information seeking behaviors, and what are the corresponding offline consequences? 4 important aspects are used to describe a health information seeking process, which are information needs, search starting points, emotion changes, and decision making. And we believe the information needs and the search starting points belongs to the online health information seeking behaviors, while emotion changes and decision makings are the corresponding offline consequences. Between the beginning and the outcome, we believe that the self-selection criteria presented in the last few slides can help to characterize the process. Therefore, this section will focus on the results of the 4 aspects and the transitions between them. And as a result, 24 valid incidents were collected from the participants' real search experiences, and they are visualized with this Sankey diagram. A set of subcategories is generated for each aspect, and the width of these flow branches is proportional to the number of incidents. Next, I will explain this diagram. First, for the information needs, we identified 4 information needs. And we found that online health information seeking is frequently used as a tool for self-diagnosis. It usually comes together with high uncertainty. For example, if consumer encounter an unsure symptom or unsure condition, they were very likely to go online to search for it. Other than the self-diagnosis, other information needs that may trigger online health information seekings are to learn about a health issue, to relieve a condition, or to pursue better health condition. Second, we identified 2 search starting points from participants' real information search incidents. And the participants mainly rely on search engines to initiate online health information seeking. It requires the capability of issuing accurate query and selecting among the search results. And very rarely, the participants will go directly to a familiar online source. Then for the emotion change, we identified 5 different types of emotion changes offline. And generally, online health information seeking helps to relieve negative feelings because we found most 11 participants feel from negative to positive after their online search. And we summarized the 6 types of decision makings. And note that the continued negative emotion is likely to push the participants to see a doctor, but in some extreme situations, it would stop the online health information seeking forever because 2 participants said that they will never go online to search for health information seeking because they kept feeling negative throughout the whole online health information seeking process. Other than that, this decision, other decision makings after online search are following the online instructions, making no decisions, decide to see a doctor, decide not to see a doctor, or reject the online instructions. The main message we want to say is that the majority of participants felt better and positive after their online health information seeking. And here we give some examples. Participants 1923 who go online to do self-diagnose feel from negative to positive. And participants 5 and 11 who go online search to relieve a condition also felt from negative to positive after their online search. However, this also raises new concerns. The first concern is that most participants follow the online instructions, like in this example. Participant 5 and 11 decide to follow the online instructions after their search. And another concern is that consumers may decide not to see a doctor after their online self-diagnose because they believe their symptoms or their conditions is very common or is mild according to the information they found online. So given these findings, we think there is a demanding need to instruct and educate the consumers on how to conduct online health information seeking more properly and more accurately. Finally, I will show our conclusions. I want to note that we expect this paper to be a starting point for designing interactions to encourage desirable online and offline actions. For example, promoting of seeking healthcare if people have health problems, relieving the searchers who feel uneasy for their health conditions. And this study highlights the question that, from an HCI perspective, how to design a better search engine and online health information seeking source to provoke preferable offline emotions and decisions. The first main contribution of this study is that we elicited the characteristics of the health consumers' preferred sources and compared with consumer selection in real practice. Then we explored the health consumers' online search and offline behaviors, characterizing the diverse process with 4 aspects: information needs, search starting points, emotion changes, and decision making. However, there are several limitations of this work. Using convenience sampling, the generalizability of the results to general health consumer populations other than the recruited college students is limited. Also, using CIT, the data were collected based on participants' recall, which was not validated or directly observed by researchers. That's all of our presentation. My co-authors and I are happy to take any questions. Thank you.